This is the Life by Design with Angela Weiss podcast, episode 65. When Motherhood Feels Scary, Postpartum Depression, Anxiety, Intrusive Thoughts, and Psychosis. Welcome back. I'm Angie, and if you're new here, I'm a dual certified family nurse practitioner and psychiatric mental health nurse practitioner. On this podcast, we talk about mental health, physical health, grief, relationships, faith, healing, and what it really looks like to build a life that feels like your own. Today, I want to talk about something that feels particularly important right now. There's been a lot of conversation in the news and on social media about postpartum mental health, and whenever something tragic involving a mother and her children becomes part of the national conversation, I think there is a risk that women who are already struggling hear those stories. They become more afraid to tell someone what's happening inside their own minds. So today, I don't want to sensationalize anyone's story. I don't want to diagnose someone I've never evaluated. And I certainly don't want to try a criminal case from behind a microphone. What I do want to talk about is postpartum mental health. Because there are women who are listening right now who may be experiencing symptoms that they do not understand. There are husbands and partners who know something is different, but don't know what they're looking at. There are grandparents, sisters, friends who may be the first people to notice that a new mom isn't quite herself. And there may be a woman listening somewhere who has never told anybody about the thoughts going through her mind because she's terrified that if she says them out loud, someone's going to think that she's crazy. And I understand that woman because many years ago, I was her. 26 years ago, after my first daughter, I experienced postpartum anxiety. I didn't have those words for it at the time. I wasn't a nurse practitioner or even a nurse, and I didn't understand intrusive thoughts. I didn't understand postpartum OCD, and I didn't understand why my brain suddenly seemed determined to show me every terrible thing that could possibly happen to this little person that I loved more than anything in the world. I just knew that I was scared all the time. And my thoughts sounded something like this. What if I forget her somewhere? What if I'm at Walmart and somehow I walk away from the shopping cart and forget that she's in it and I leave? What if I forget she's in the car? What if it's hot outside and she dies because I forgot her in that car? And I want to make something extremely clear. I never wanted to hurt my daughter. I didn't have the urge to hurt her in any way. I wasn't making a plan to hurt her. Those thoughts were horrifying to me because the possibility of something happening to her was the worst thing that I could have ever imagined. But I didn't know that distinction then. All I knew was, why am I thinking these things? What kind of mother thinks something like this? And what if I did tell somebody? And probably the biggest one, what if people think I'm crazy? So I didn't talk about the way I felt. And looking back now after all these years, after becoming a psychiatric provider and after working with women every single day who describe experiences very similar to mine, I wish somebody had explained it to me back then. I wish someone had said, hey, Angie, having intrusive thoughts doesn't mean you want the thought to happen. I wish someone had taught me that there's a difference between being afraid something terrible will happen and wanting something terrible to happen. Those are not the same thing. And if that's the only thing a new mother hears from this entire episode, I want her to hear this. A thought is not an intention. So what are intrusive thoughts? Intrusive thoughts are unwanted thoughts, images, impulses, or mental pictures that seemingly pop into your mind. Sometimes they're bizarre and sometimes they're violent. Sometimes they're completely opposite to your values, and that's one of the reasons they're so upsetting. Research on postpartum OCD describes intrusive infant harm thoughts as often being ego-dystonic, which essentially means that the thought is inconsistent with what the person actually wants, believes, and values. In plain English, the thought horrifies you because you don't want it. That's what was happening to me. I wasn't thinking, hey, I want to leave my baby in the car. I was thinking, oh my gosh, What if somehow I actually forgot her, forgot that she was mine, forgot that I had a child and left her there? And then my brain wanted certainty. How do I make sure that never happens? Should I check again? What if I get distracted? What if I'm tired? What if? That's anxiety. And sometimes those thoughts and the behaviors surrounding them can become obsessive compulsive symptoms. Postpartum OCD can include intrusive thoughts about accidental or intentional harm coming to a baby, as well as checking, avoidance, reassurance seeking, and other behaviors intended to neutralize the anxiety. Here's the cruel part. A woman may love her baby so much that the very thing she values most becomes the thing anxiety attacks. But what if someone thinks I'm dangerous? This is where I want to talk about what directly matters to moms, because now I sit on the other side of that conversation. I work with women who are suffering with this, and I have heard women tell me things they were absolutely terrified to say out loud. They might say, I've never told anybody this before. Or, promise me you're not going to think I'm crazy. Or, I don't want anyone to take my baby away. And sometimes you can see the fear on their faces before they ever even tell you what the thought actually is. As a psychiatric provider, I don't hear the content of one frightening thought and immediately make an assumption about that woman. I assess it. What is the thought? Is it unwanted? Does it scare her? Does she believe the thought? Does she want it to happen? Does she have any intention on acting on it? Does she feel compelled or commanded to do something? Is she hearing or seeing things that other people aren't? Is she sleeping? Is she manic? Is she confused? Is she paranoid? Does she have insight? What is her history? What support does she have? Are there immediate safety concerns? Those distinctions matter enormously because postpartum anxiety, postpartum OCD, postpartum depression, and postpartum psychosis can overlap in certain ways, but they are not interchangeable diagnoses. Baby blues aren't the same as postpartum depression. We should start with something many people experience after delivery, and that's the baby blues. You just had a baby, your hormones are changing rapidly, you're exhausted, and your body hurts, your sleep is completely disrupted. Maybe breastfeeding isn't going the way that you expected or planned, and you're crying because somebody looked at you the wrong way, and you're crying because the baby is beautiful, and then you're crying because you can't find the other sock. There can be tremendous emotional fluctuation immediately after childbirth. ACOG distinguishes those common temporary postpartum emotional changes from a depressive disorder. Perinatal depression can occur during pregnancy or after delivery and deserves assessment and treatment when symptoms become persistent or significant. Postpartum depression may look like sadness, but it doesn't always look like a woman crying all day. It can look like feeling numb or detached, feeling guilty, feeling hopeless, feeling like you're failing, not enjoying anything, feeling disconnected from your baby, having difficulty concentrating or feeling irritable and angry, being overwhelmed by things that normally wouldn't overwhelm you, having significant sleep disturbance beyond simply waking because the baby wakes, and sometimes experiencing frightening or disturbing thoughts. The National Institute of Mental Health recognizes anxiety, sadness, sleep difficulty, and disturbing thoughts among symptoms that can accompany postpartum depression. And none of those symptoms mean someone's a bad mom. They mean we need to ask more questions. Postpartum anxiety can be restlessness. Sometimes it hides itself incredibly well. A woman may look like she's functioning, the baby's fed, and the diaper bag is packed, and the pediatrician appointments are made. Everybody thinks she's doing great. Meanwhile, inside her mind, is the baby breathing? She checks. Then she checks again. What if she chokes? What if I drop her? What if somebody else drops her? What if she gets sick? What if I miss a symptom? What if I fall asleep and I don't hear her? What if somebody kidnaps her? What if there's an accident? She may avoid leaving the house. She may be terrified to let anyone else care for the baby. Or depending on the nature of the intrusive thoughts, she may become afraid to be alone with the baby. She may Google constantly. She may seek reassurance over and over. She may check looks, temperatures, breathing monitors, locks, doors, car seats repeatedly. And because being vigilant feels like protecting the baby, it can be very difficult for her to recognize when vigilance has turned into anxiety that is consuming her life. Pregnancy and postpartum are recognized periods in which clinically significant anxiety can occur, and screening tools are necessary. I've been there. I've been the mom that didn't connect with her second child initially or was checking constantly. So I want to spend a little time on postpartum OCD because I think this is where women get frightened to speak. Our intrusive thoughts, they involve something that's happening to a healthy baby, and sometimes intrusive thoughts can contain incredibly disturbing images involving the mother herself harming the baby. And imagine being a woman who loves her child more than anything in the world, and suddenly an image that flashes through her mind, she might think, oh my gosh, how did I think that? And then if I thought it, does that mean I would do it? Then she becomes hyper-focused on the thought. She tries desperately not to think about it, which unfortunately often makes the thought come back even more. Then she may avoid whatever triggered it. She may hide knives. She may refuse to bathe the baby. She may not stand near a staircase while holding the baby. She may ask someone else to take over certain tasks, not because she wants to hurt her child, because she's terrified of the possibility that she could. That pattern can occur with postpartum OCD, and the clinical literature makes an important distinction between these unwanted, distressing, ego-dystonic, intrusive thoughts and psychotic symptoms in which reality testing or insight may be impaired. And that doesn't mean we dismiss the intrusive thoughts. We assess them carefully, but intrusive thought does not automatically equal intent. And if you are listening to this and thinking that's me, please don't let shame prevent you from taking your healthcare seriously and talking to your healthcare provider. Postpartum psychosis is different because we're hearing that term more often right now, and people sometimes use postpartum depression, anxiety, psychosis as if they're different degrees of the same thing, and they're not. Postpartum psychosis is a psychiatric emergency. The National Institute of Mental Health describes symptoms that can include hallucinations, delusions, paranoia, confusion, and manic symptoms. That may look like a woman hearing voices that are not there, seeing things other people don't see, and developing a fixed belief that isn't based in reality, becoming extremely paranoid, behaving in a very disorganized or bizarre way, becoming extraordinarily energized or agitated and needing little sleep, experiencing severe confusion or losing the ability to distinguish with what is real from what isn't. This isn't, if I'm scared, I might somehow forget my baby in the car. This may be, I know that God has commanded me to do this, or I know that my baby is possessed, or I know people are coming to take us and I have to save my baby. Those are examples, and they're not a checklist, and certainly not every presentation, but I want you to hear the fundamental difference. With an intrusive obsession, the person often says, this thought is horrifying, I don't want it, why is my brain doing this? With psychosis, the individual may have impaired insight and may believe something that objectively isn't true. That's why assessment by a qualified provider is so important. And that's why significant postpartum changes involving hallucinations, delusions, severe confusion, mania, paranoia, and the loss of reality testing require immediate medical attention. It's not something to mess around with. I also want families to pay attention to sleep. Obviously, new parents don't sleep normally. That's not news to anyone who's ever brought home a baby. But there's a difference between the baby woke up 6 times and I'm exhausted, and she has barely slept for several days and she doesn't seem tired, or she's becoming increasingly activated, agitated, confused, paranoid, or behaving very differently. That is important to take note of. And this is particularly important when there's a history of bipolar disorder or previous psychosis. Don't simply tell her, you need to get some sleep. Help her to get an evaluation so that she can get the help she needs to sleep. To the partners and the families listening, sometimes the woman experiencing this cannot fully see how much she has changed. So I want to talk to the people around her for a minute. Don't only ask, hey, are you okay? Because she's probably going to say, yeah, I'm just tired. Honestly, I just need to get some rest. Try, you seem more anxious than usual. What's going through your mind? Are you able to sleep when somebody else has the baby? Have you been having thoughts that scare you? Do you ever feel like you can't shut your brain off? Do you feel like yourself? Are you seeing or hearing things that other people can't? Do you ever feel like something or someone is sending you special messages? And if her answer concerns you, don't shame her. Don't argue with her. Don't say, how could you think something like that? Say something more like, thank you for telling me. We're going to get some help for you. Because shame makes people hide. And hiding is exactly what we do not want. To my fellow healthcare providers, I want to say something to us too, because we have to make it safe for women to tell us the truth. If we ask any depression or anxiety and move on 2 seconds later, we shouldn't be surprised when someone says no. Sometimes we need to ask better questions. Since having the baby, has your mind been giving you frightening thoughts or images that you don't want to have? Do those thoughts feel like something that you're afraid of or something you actually want to happen? Do you believe the thought is true? Do you feel in control of what you do? Are you hearing voices or receiving messages that other people aren't? How much are you sleeping? Do you feel unusually energized even without sleep? Has your family told you that you're acting differently, out of character? And then listen, don't visibly recoil. Don't punish honesty. Assess, clarify, differentiate, treat, escalate when necessary. ACOG's perinatal mental health guidance specifically includes screening and diagnostic of depression, anxiety, and related disorders, bipolar disorder, suicidality, and postpartum psychosis. It's important. It's important. This isn't an optional part of women's healthcare. It is healthcare. Treatment works, and this is where I want to bring some hope into this conversation. Postpartum mental health conditions are treatable. Depending on the diagnosis and the individual woman, treatment may involve psychotherapy, medication, increased social and practical support, protection of sleep, treatment of contributing medical conditions, and sometimes a higher level of psychiatric care. For perinatal OCD in particular, cognitive behavioral therapy with exposure and response prevention, often called ERP, the serotonergic medications such as SSRIs are established treatment approaches. Postpartum depression also has effective treatment options, including psychotherapy, traditional antidepressant treatment, and appropriate newer interventions. The treatment plan has to be individualized, and breastfeeding status, that matters too. There are medications that we have to use specifically there. Bipolar history matters, severity matters, safety, but the overall message is there is help. You don't have to wait or white knuckle your way through this because everybody told you motherhood's supposed to be beautiful, and maybe it's not. Motherhood can be as beautiful as it can be and still be hard. And maybe we need to normalize saying both things at the same time. You can love your baby desperately and hate the postpartum period. And you can be grateful and be depressed, and you can be a wonderful mother with anxiety. You can bond beautifully with your baby and still experience intrusive thoughts. And you can want this child more than anything in the world and still need psychiatric treatment. One does not cancel out the other. I think we've romanticized motherhood in a way that sometimes makes women believe there's only one acceptable emotional response after childbirth. I'm so blessed, I'm so happy, everything is just perfect. And then when reality doesn't match that picture, women think something's wrong with them. No, birth is enormous. Your body changes. It's a stressful event. Your hormones change. Your relationships, they change, and your sleep changes. Your identity, that changes, and your responsibilities change overnight, and sometimes your mental health changes too. You deserve care for all of it. What I wish someone had told me when I was a young mom, scared that I might forget my daughter somewhere, somehow, allow something terrible to happen to her, I wish I could sit with her now, because now I have language that I didn't back then. I tell her, those thoughts scare you because you love your daughter. You don't have to hide them. You're allowed to ask for help. Your mind is stuck in a deeply anxious loop, and we can help you get out of it. And maybe most importantly, telling someone what you're experiencing doesn't make you a bad mom. I can't go back and give that knowledge to that younger version of me, but I can give it to somebody listening today. And that's the part of why I wanted to do this episode. Because now I work with women experiencing this every day. And sometimes I hear their fears and recognize pieces of that younger woman I was. The woman who is sitting across from me saying, please don't think I'm crazy. I get to say, tell me what's happening. That's where care begins. If this is happening to you, if you recognize yourself somewhere in today's conversation, please tell someone. Tell your OB, tell your primary care provider, tell your psychiatric provider, tell your therapist, tell your partner, tell someone you trust, and let them help you connect with care. And if you're experiencing hallucinations, delusions, severe confusion, paranoia, extreme agitation, or mania, feeling disconnected from reality or your thoughts, or want to harm yourself or someone else, that needs immediate evaluation. Go to your nearest emergency department or call 911 or 988. Don't try to manage a psychiatric emergency alone. And family members, if you believe a mother has lost touch with reality, or there is an immediate safety risk, please treat it like it's a medical emergency, because it is. Postpartum psychosis is a medical emergency requiring immediate help. We can only treat the person in front of us, okay? The symptoms that we're told, the person that we're seeing, that's what we can treat. So please understand that we are there to help you. You're allowed to tell the truth about what motherhood feels like, even when it's ugly, even when it's frightening, even when the thoughts embarrass you, even when you adore your baby and can't understand why your brain is producing thoughts that feel completely opposite to the love that you have. Silence does not protect women. Education does. Compassion does. Good assessment does. Treatment does. And being able to sit across from another human being and say, something is happening to me and I need help, can change everything. So if this episode makes one woman less frightened to say that sentence, then this conversation was worth having. Thank you for spending time with me today. This is a heavy topic, but it's one that we need to talk about. If you know a new mom, a pregnant woman, a partner, a grandmother, a healthcare provider, honestly, anyone who needs to understand postpartum mental health better, please share this episode with them. Sometimes the information that feels ordinary to those of us who work in healthcare is the information somebody else desperately needs and has been searching for. And if Life by Design has been helpful to you, please like, follow, or share. This podcast is for educational purposes only and does not warrant a provider relationship with me. Please seek mental health, medical help from your trusted provider in the area where you live. Thank you so much for being with me today.